Well, my dearest friend got cancer, and as a result of the treatment she was receiving for her cancer, she developed sores inside of her mouth. She became very, very filled with pain. Everything that she did, from breathing to eating to sleeping to literally functioning, the quality of her life was decreased because of what was happening in her mouth. We tried so many things, and I was at a convention and someone introduced this product to me, and instantly she got relief from it. It changed the quality of the end of her life. And I have been able to take this product to people who are experiencing pain and suffering unnecessarily. And this product makes a world of difference in the quality of their life at the end of their life. I mean, I am a registered dental hygienist in alternative practice, and I specialize in seeing special needs patients and end-of-life patients. And when someone wants to be able to smile at their family for that last smile, they want to be able to eat the things that they enjoy, they want to be able to simply breathe, and they can't do that because of the treatments they're receiving to prolong their life. And we have a simple product that not only helps them with nutrition, but helps them with pain, helps them with the suffering they've been going through. It's the word has to get out there. People have to start to know how important this product is, and incorporating it into everyday life of cancer patients and of special needs patients. It depends on the patients that I'm working with. With cancer patients, what I'm doing is keeping a tube by the bedside. And during the day, when they get dry mouth and when they get with problems with the lesions that are in their mouth, I'm having them put it on their tongue and take the tongue and move it around the mouth and then swallow. A lot of times they'll have lesions in the throat, so we don't really want them to spit it out. We want them to get that soothing product right down into the throat. With the patients that I'm dealing, I also work in a free clinic. And working in the free clinic, I see a lot of people that are going through stages of drug abuse. And it really impacts their mouth, their health, and all the way around. What I'm having them do is carry the tube with them wherever they go. The great thing about MI paste is, comparing it to other products such as Prevident 5000 or other products like that, is you get a lot of stomach upset when you have high doses of fluoride. And yet with this, I'm not getting that with the cancer patients or with the people that are trying to recover from drug addiction. It doesn't have the side effects that we get concerned about when someone's taking it in over a long period of time. I'm a hygienist. The first thing I'm going to do is go, what's the science? I went to school for 4 years to learn what the science was. And that's really important to me. Science is the base of what I do. I don't want to give anything to my patients that's going to harm them. The second part that I have to look at, though, is the practicality. Is this a practical item that patients are going to really go home and do? And because of the flavor, the consistency, the ease of use, the results that they're going to see in the end, they're going to do it. And they are doing it. And that is really rewarding for me. The last thing is the ease of application. When I have a client who's in bed who can't get up to go to the sink, when I have a mom who's taking care of 3 kids and isn't necessarily going to be there for 2 minutes to brush 3 kids, which adds up to 6 minutes plus the cleanup time, I have to find something that is realistic for them to do. The science is there, the practicality is there, and the ease of use is all there. And that's why I love this product. When I have a 15-year-old who comes in, who has white spot lesions from lack of care and from life, malnutrition, whatever it is that brought those white spots into her life. The last one that I had a fever as a child that was left untreated, and she ended up with major white spots. And we did the very basic therapy of just doing acid etch, sending her home with trays with MI paste in it. And for the first time in all the years that I've seen her, to see a smile on her face because she no longer had giant white spots on her teeth. It's just such a simple thing. And to get that message across to people, it's great that we get to do that. Well, my dearest friend got cancer, and as a result of the treatment she was receiving for her cancer, she developed sores inside of her mouth. She became very, very filled with pain. Everything that she did, from breathing to eating to sleeping to literally functioning, the quality of her life was decreased because of what was happening in her mouth. I couldn't change her having cancer. I couldn't change her passing. But I could make that passing a much more comfortable and pleasant experience. And it's amazing to me, a lot of people, healthcare professionals, don't look to dentistry for that part of our role. And we have a major role there where we can comfort someone who can get comfort in no other way. And what a privilege it is to be a healthcare professional that can soothe someone in a time of their life that can get it no place else. It's a privilege to be a part of that. And it's a privilege to have that product out there to share.